Oh, it's definitely helping you, and that's okay, right? Because we want you to have access to that larger movement, but we do need at some point to transition over to kind of, it's going to be harder. It's going to potentially, your scores are going to go down, and that's okay. But the thing is what we care about, or what I care about, is your function outside of the Modus hand.
Hey everyone, my name is Dr. Nick Halsey with Modus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
I know that in my case, the one is not corresponding to my movements.
Interesting. Yeah. Well, that's we might want to dig into that and see what's going on there. I am looking at the data really quickly. I don't know if you guys have had a chance to look at the reports. I was just taking a look at that, and I'm really encouraged, actually. You've got some really nice general trends, especially in your intensity measure, which is something that I look at kind of the first pass for me. I'm looking and I'm seeing some really nice shifts in intensity, which are really good. We're about a month or so in, maybe a bit more than a month in. Let's see, we've done about 30 hours of rehab.
Actually, I think we're...
Oh, yeah, approaching a month and a half at this point.
Right. We're actually, our
Yep.
time is, our 2-month time is up this time next week.
This time next week. Okay, very good. So I'm seeing some really good trends here in some of these metrics, which are really good. This one in particular.
Any the games come out to you with anyone?
Sorry, Jonathan. What was that?
Any of the games you see more promising for me than the other ones?
Oh, interesting. Yeah. So I think for this report that I'm looking at right now, I don't have the game level data, but we can certainly look into that, though. I think one that is, let's see. There are a couple of spikes here which are a little bit interesting. I don't think necessarily I see any individual. I don't see anything as a red flag. Let's put it that way. I do see that while all our intensity is going up, we haven't really made adjustments on the sort of the ranges of motion or the actual assistance levels. And those may be times for us to, or points where we can actually work together to change the stimuli to make sure that we're getting the most out of it. So I think those would be two cases where we should probably spend a little bit of time and modifying things.
Dr. Nick, what is intensity? What is that a measure of?
Good question. Yeah, so intensity is the amount of repetitions over unit time. Yep. So
repetition is flexion and extension.
The
outward effort, is it outward effort? Did you see me?
Yes, exactly. Yeah. So the intensity is a good metric. If I were to look at one determinant of rehab, I would say probably intensity is one of the best things, because it encapsulates kind of how much dose you're getting in a given unit time. So it's a really important thing because our bodies respond to intensity. We can handle a lot of low level stimulation for a long time. So like if you were to do 1,000 repetitions in, let's say, a 10-hour period, that would not cause the same response for you as it would be if you were to do it in like a 1-hour time frame or a 2-hour time frame.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Modus Nova is changing neurorehab.
Time frame or a 2-hour time frame, right? That compression of the time makes it much more challenging for your system to adapt. And so that's why I like those as being kind of one of my main metrics that I look at.
Okay, so intensity is repetitions per unit time or something like that.
Exactly. Yep. And so you can see here at my graph, you can see that we have this sort of nice trend. Of course, there's noise because we're humans, but there's this nice trend going up into those movements per unit time, which are really nice. And that's been since June, a little before June, since we first started capturing that data. It was a fairly nice trend from day one, probably doing around 10 repetitions per minute. Now we're regularly up past 20, 22 per minute, which is really good, a doubling of that.
Now, is this distinguishing between the pneumatic air assist and Jonathan's actual movement, or is it a combination?
Yeah, it is a combination of that. And the way we can actually interpret the, if you look at these data over here, we can see that there is a trend in, this is a little bit noisy, this is the last couple of sessions. There are periods where Jonathan is able to do more movement by himself, okay? So I think that's a little bit variable. I think this is one of the reasons why I'm suggesting that we need to address this, because we can, if we find that we can actually reduce the assistance, what that means is you're going to be encouraged to do more of the movement yourself, Jonathan. That's our outcome. Yeah, we want that. We exactly want that. And because the point at which you don't need any help anymore with the Modus Hand is a very, very happy day in my life, and it should be a very happy day in your life, right? So we need to work towards trying to reduce the amount of assistance that's providing. I think that's going to be our next target for you, is to try to reduce that assistance while we keep the intensity and all this stuff. But that's going to be one of the main things. I'm seeing right now we're consistently around maybe 75% is Modus Hand, and maybe 25% is around is Jonathan. So I would like to see us kind of change the balance there, slowly work down that amount of assistance that's being done by the Modus Hand, and then that would you would become more independent over time.
I don't have any control of the Modus Hand. The machine tells me to stop and stop, right?
Yeah. And I think one of the things that we can do is I can change some of the parameters to make sure that it's going to effectively encourage you to do more of it independently. Because early on, that's okay that we need that help, but we don't want to become dependent on that help. That's not what we want.
I think that's what's happening to me now. That's exactly what's happening.
Oh, it's definitely helping you, and that's okay, right? Because we want you to have access to that larger movement. But we do need at some point to transition over to kind of, it's going to be harder. It's going to potentially, your scores are going to go down, and that's okay. But the thing is what we care about, or what I care about, is your function outside of the Modus Hand. The Modus Hand is really a way to help drive that outcome that we want. And so that's something that I just need to be honest with you guys, is that maybe the performance in game may go down, but that's okay, right? That's okay. We need to push for those harder efforts where you're doing more of the work.
Any of those games jump out in your conscience? Like I think the Plinko is pretty good for me.
Sure. So honestly, I think the ones that are really good, the ones that are really good for this are those games that I think initially, again, this will change over time, but those games like the ones you mentioned, the Cosmic Tennis and the Brick Breaker, those are really good because they don't have so much on the temporal side. They're not moving crazy fast. You have time to react, right? But those are really good for you to be effortful, be extremely effortful, and try to move. And since you're using it on your left side, I don't know if you've talked about this before or seen this, it's really good to use your right side as well to do what we call mirroring. And so one thing I'd like to do to really try to supercharge what your brain can do is as you're moving up with your left hand, let's say you can see the ball is going to the right-hand side of the screen, you're trying to go get the ball, start moving up with both hands, okay? And the reason being is when you start to use your right hand, you start to recruit those motor networks. And this is a way to kind of hijack your brain, trick it into trying to activate, in your case, your right side of your brain, which has a damage to it. And so it's a nice way to kind of leverage both your systems because you can, we talk, we're bimanual creatures. I gesticulate and we talk and use both hands. So that's a way to kind of trick the system a little bit and use what you have. So I'd say as we move forward into our next steps, really try to do that and stay engaged in those exercises. So I'd say those two, yeah, go ahead.
I was going to say what you're saying is sounds to me like what the mirror box concept is about.
Precisely. And the interesting thing about this is the mirror box is a trick that we can use, visually. But the cool thing is here with the Modus Hand, it's not like your left hand is not actually moving because in the mirror box, it's not actually moving, right? Right. It's just your right hand, your less impaired side is kind of mimicking that. Here, your left side is actually moving, right? Because the Modus Hand's there to help you do it. And the good thing about that is it's not simply outflow to our hand to cause movement. Really, really important element to motor control is the sensory information that's coming back from our limbs to help generate and recruit those networks. So as you're actually physically moving with your left hand with the Motus hand on, it's starting to propagate back the sensory information about where your body is in space. That's really, really important. So I'd say it's very much like that concept of mirror therapy, but it's a little bit step in the right direction because you're actually moving in this case.
And dare I say, less boring.
Sure. I wasn't going to go that far, but yeah, sure.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.